The placement of a nasogastric tube is indicated for short-term gastric feeding for a maximum of 6 to 8 weeks and can be used for stomach decompression. The procedure should only be undertaken by a skilled healthcare practitioner who fully understands the associated risks and contraindications. Nasogastric tubes should not be used in patients with delayed gastric emptying and/or with increased risk of aspiration. Amongst the contraindications to nasogastric tube insertion are injuries or bleeding in the esophagus or upper gastrointestinal tract, if the patient has a head or neck injury. Feeding via the tube should not take place if the patient has paralytic or mechanical ileus, an acute abdominal condition, or suffers from intestinal absorption failure. This list is not exhaustive, hence the need for a skilled healthcare practitioner to make the decision for using a nasogastric tube. The Nutricia Flocare nasogastric PER tubes are available in a wide range of lengths and charrières, and with multiple types of connectors. The tubes are available in polyurethane, PER, and silicone, and are offered with or without guide wire. The Nutricia Flocare nasogastric tubes have a number of key features. They are designed for easy insertion, and the tube position can be easily confirmed by X-ray. The tubes contain 3 white opaque lines to improve visibility under X-ray and supports confirmation of tube position, which enhances usability for the healthcare professional and improves safety for patients, and thereby providing best care. Flocare has a transparent polyurethane tube with blue printed 2 cm block markings with numbers and dot markings at intervals of 1 cm. The blue colour, as well as the increased rate of markings, will further enhance usability and easiness of placement for healthcare practitioners. Flocare also has a tip with lateral and distal outlets. Siliconized guide wire for easy removal of the wire once correct placement has been confirmed. Flocare is available with funnel connection or with male Luer lock. Prepare the following materials required for placement of the nasogastric tube, ensuring that expiry dates are current and that packaging is intact before use. Nutricia Flocare nasogastric tube. Hypoallergenic tape. 50 ml enteral feeding syringe. A small container with water to moisten the tip of the tube. It is important not to lubricate the inner lumen or guide wire at this stage of the procedure. A glass of water if the patient has a safe swallow and is not nil by mouth. Tape or a marker to mark the correct placement of the tube if your local policy requires that you do this. A paper handkerchief and a small towel. pH indication strips, which are CE marked, correctly stored, in date, and license for testing the acidity of human gastric aspiration. Disposable surgical latex-free gloves, hand sanitizer or antibacterial soap, and a disposable apron. Having undertaken a prior full risk assessment, explain the procedure to the patient in order to gain informed consent. Ideally, help the patient into a comfortable upright position, or semi-recumbent, as upright as possible, well supported by pillows. Infection control techniques should be practiced at all times. Wash your hands with antibacterial soap and wear surgical gloves and a disposable apron. When using a tube with a guide wire, introduce the guide wire completely into the tube prior to placement by pushing the handle of the guide wire completely into the large opening of the feeding connector. Ensure that the guide wire moves freely within the tube, and if in doubt at all, a flush with air will confirm tube patency. Never use water to flush at this stage. In order to gain an indication of how much tube will need to be inserted, take a neck's measurement. This is from the nose to the earlobe and then to the xiphisternum. While some practice may be to mark the tube at this point, it is not advised, as the tube may need to be inserted further, and for some tubes marking is not possible, but you must record the centimetre marking length. Ask the patient to sit with their head facing forward and explain to them that they can use a stop hand signal at any time to halt the procedure.
Okay, so if you could copy me, so I know that how, yes, okay.
Place a towel on the patient's chest, or if the patient is a child, they may be swaddled in a sheet and held in the appropriate way. Ask the patient to blow their nose. Use alternate nostrils each time the tube is changed, unless there are any contraindications, or the patient expresses a specific preference, or choose the nostril through which the patient breathes most easily. Submerge the tip of the tube into the container with water. This will facilitate the introduction of the tube. Gently introduce the tube into the chosen nostril.
Okay, are you ready for this?
Yes.
Slowly advance the tube and ask the patient to swallow by drinking small sips of water, providing that the patient is not nil by mouth and it has been confirmed that it is safe to swallow fluid. Push the tube gently, never force it, and avoid inadvertent tube placement in the trachea. Stop at any point if there is any resistance or the patient becomes distressed. Be mindful of how many attempts are permitted within your local protocol. Introduce the tube further until the next measurement indicator is at the nostril. Confirmation of gastric placement by pH measurement must be obtained before any fluid is flushed down the tube or removal of the guide wire or stylet. After placement of the tube, the position must be confirmed by pH testing, with the achievement of a pH value between 1 and 5.5. Best practice requires that if the pH value is between 5 and 5.5, a second competent person must independently verify this value before any liquid is administered into the tube. The guide wire may now be removed following confirmation of correct placement and must never be reinserted into the tube. It is important to note that guide wires and stylets, which do need lubrication, must never be lubricated until gastric placement has been confirmed. Always check the latest manufacturer guidelines for up-to-date advice. Tape the tube to the side of the face, just beside the nose, and if possible, place a hydrocolloid dressing on this area of skin first, taping the tube to the dressing rather than directly onto the skin. This reduces pressure on the nose and maximizes patient comfort and compliance. Note the external visible tube centimetre length markings at the exit point of the nostril. The tube can now be marked at the nostril in order to determine what length of tube was inserted. Whilst an X-ray may be used in acute settings to further confirm placement, it must never be used as the only test. Now that the tube is secured and correct placement is affirmed, inject a volume of water into the tube as directed by the managing healthcare professional. This must not exceed 50 millilitres of water, ensuring that only a specifically designed enteral syringe is used for this procedure. This will avoid acidification and coagulation of tube feed, and as a consequence will avoid tube obstruction. Never use syringes smaller than 20 millilitres as they might provide too much pressure in the tube and may cause the tube to rupture. Enteral syringes are the only syringe type recommended for this use. The following details will need to be recorded in the patient's medical chart. The practitioner's name, pH value of gastric aspirate, the tube brand name, size, Charrière, and expiry date, the batch and lot number, the next measurement, external tube length, which nostril was used, and the number of insertion attempts. If tube location was confirmed by X-ray. If a second competent person verified the pH value, their name should also be recorded. Infection control techniques must be practiced at all times. Wash your hands and wear surgical gloves whenever handling the tube feed or feeding system. Patients or their carers in the community may choose not to use gloves, but should be mindful of the potential for cross-contamination. The position of the tube must be checked before every administration of liquid after bouts of vomiting, retching or coughing, when the tube feed is changed, or whenever the position of the tube is in doubt. This is performed by checking the next measurement against the patient records and by ensuring the pH of aspirated gastric content is between 1 and 5.5. If the location of the tube is in doubt, the position must be confirmed by X-ray. The tube should be flushed before and after feed or medication administration with 20 to 40 milliliters of water and at least every 8 hours or as per the patient's feeding regimen from the dietitian or managing healthcare professional. A new Flocare feeding set should be used every 24 hours. The hanging time of the tube feed is limited and you should check the instructions on the label for guidance. Care of the nose and mouth are very important. Ensure that the tape is removed and replaced if it becomes dirty or loose. The skin should be cleaned and a new tube placed in the other nostril if the skin is damaged. Regular care of the mouth, teeth and lips are especially important when the patient is not able to eat or drink. Immediately stop feeding and ask for medical help when there are doubts about the patient's medical condition, such as shortness of breath, abdominal pain or vomiting, which may indicate misplacement of the tube. The Flocare per tube should be replaced every 6 to 8 weeks. If the nasogastric tube does get blocked and you cannot confirm its position by gastric aspirate, do not flush it with air or water or use it in any way, and report this to the managing healthcare professional, as the position of the tube cannot be confirmed and may be misplaced in the lungs. Do not use excessive pressure when using the tube in order to prevent tube rupture. Replacement of the tube will be necessary when a tube becomes blocked. Never reinsert a guide wire during placement or while the tube is in situ. Also, never reinsert a guide wire to clear the blockage, as this may cause perforation of the gastrointestinal tract. The Nutricia Per and Per Soft nasogastric tubes are offered in a wide range of Charriere sizes and lengths, to enable healthcare professionals to place nasogastric tubes with enhanced safety and comfort, further enabling patient well-being.